My name is Sarah Clark, and I'm with the C.S. Mott Children's Hospital National Poll on Children's Health. Over the last decade, there have been several new vaccines recommended for adolescents. And for the most part, uptake of these new vaccines has been pretty good. But the one that lags behind is the vaccine against human papillomavirus, or HPV. In the short term, HPV vaccine protects against genital warts, one of the most common types of sexually transmitted infections. In the longer term, HPV vaccine protects against cervical cancer for women, and for men, several types of head and neck cancers. HPV vaccine is most effective when given before exposure to human papillomavirus. And for that reason, vaccination is recommended early in adolescence, around age 11 or 12. And that presents a challenge. When parents bring their 11 or 12-year-old children to the doctor, they aren't thinking that their child is ready for sexual activity. And so the conversation around HPV vaccine can often be uncomfortable. Many parents ask to delay HPV vaccine until the child is a little older. That presents another challenge because there's good data to show that older teens don't visit the doctor as much, and when they do, often a parent is not with them. So public health officials have been searching for ways to increase HPV vaccination rates. And one strategy being considered is to allow HPV vaccination without parental consent. To gauge public support for laws about parental consent, we conducted a national survey of U.S. adults through the C.S. Mott Children's Hospital National Poll on Children's Health. What we found was that a majority of U.S. adults, around 55%, indicate that they support state laws that allow the testing and treatment of sexually transmitted infections. Remember, these are the laws that already exist and have existed for decades. When we asked about laws for the prevention of sexually transmitted infections, a slightly higher percentage, about 57% of our respondents, indicated that they would support such laws allowing for prevention of STIs without parental consent. However, when we asked specifically about HPV vaccination, less than half of adults, only about 45%, said that they would support state laws allowing HPV vaccination without parental consent. We asked those who would not support state laws allowing HPV vaccination without parental consent what were the main reasons why. And overwhelmingly, respondents indicated that HPV vaccination should be a parent's decision. If public health officials seek to move forward with this strategy, they need to appreciate the public's reluctance in this area and do some education to ensure that adults understand the importance of HPV vaccination as a form of STI prevention.